Dr. Chris here with another part of the Women's Health series. Today I thought I'd talk about perimenopause. What is perimenopause? It's the few years that happen before menopause is diagnosed or heralded, for want of a better word. Perimenopause can happen around 5 years, up to 5 years before you have your last period, and that can be really a tumultuous time for a lot of women with lots of symptoms. So they can have things like hot flushes or irritability or mood changes. Their periods can become either shorter in duration or longer in duration, heavier or lighter, or they might go months without a period and then they'll get lots of periods in a row. And so that's a sign that the hormones are starting to change and probably menopause is on the horizon. It can be hard to diagnose perimenopause from a blood test or from what I generally use a lot of the time, which is saliva hormone testing, because those are just snapshots in time and your hormones might be okay on the time of testing and not okay the week after. So it's very hard to diagnose that from a laboratory sense. We still do that sort of testing because it can give us some clues, but the best way to diagnose perimenopause is from symptoms. So it's a clinical diagnosis from a doctor that's seen a lot of it and can diagnose hormone issues in particular. I find that it takes quite a lot of understanding and a few questions around what's happening at the particular time. Perimenopause can be a confusing time because you don't know whether you should go on hormone treatment, you should go on the pill, you should take hormone supplements, what you should do in your diet. Oftentimes it's trial and error. It's finding what works for you and discussing with someone that understands hormones around what to do around that time in your life. For some, they can get away with some lifestyle changes like yoga or walking or doing things like massage and acupuncture and meditation. For some women, they can get away with just some simple lifestyle changes. For other women, they require some supplementational support, some natural herbs that can help transition that. And for others, it's hormone therapy. We generally don't like to use the pill after the age of 40. For reasons such as increased risk of DVT or blood clots and potentially an unknown cancer increased risk. So we generally don't use the pill after the age of 40, although for some women who have been on the pill and they're happy with it and they have very low risk of any of those things I just mentioned, we keep you on it until you feel like you would like to come off to see where your body is at and what's going to happen. If you feel like you're going through perimenopause and you'd like a little bit more information around what do I do, feel free to ask any questions below. I do have a questionnaire on my website that can look at hormone imbalance to see where you might be at, so feel free to partake in that and have a look at that. But I look forward to answering any more questions that you have around hormone balance in the next part of the Women's Health series.